This treatment plan is the recommendation of Dr. Gary Glassman. Kerr Endodontics is a medical device manufacturer and does not dispense medical advice. Clinicians should use their own judgment in treating their patients.
Once we've achieved straight line access and we've identified the orifices of the canal, now we're going to demonstrate how to shape the canals. First, we're going to use our hand files to create a glide path. Now, a glide path is essential in order to create the pathway for which our TF files will follow. It's important that we own the canal from orifice to apex. Nickel titanium files will make a small hole into a larger hole. We don't want it to create the hole. We depend on our hand files to do that. We've established that our working length is 21 millimeters. So we're going to set all our files at 21 millimeters. First file we're going to use is a number 8 hand file. So we're going to fill up the pulp chamber brim full with sodium hypochlorite, and we're going to dip our files in a viscous chelator such as slick gel. You may decide you want to use another chelator like RC Prep. Either way, they act as a lubricant for your files, and they both contain EDTA. So we place our files using a clockwise, counterclockwise motion to our working length in the mesiobuccal canal, the distal buccal canal, and the palatal canal. The 08 seemed to go quite easily. Now, it's important to adhere to the concept of what's called apical patency. Apical patency refers to taking an 08 hand file anywhere from 1/4 to 1 millimeter past the apical constriction. What this is going to do is prevent the accumulation of dentin debris from blocking yourself out at the apical 1/3. In addition, what it's going to do is allow that dentin debris to stay in suspension and then be evacuated out coronally. And we do that with an innocuous 08 hand file. An 08 hand file is small enough that it's not going to cause damage to the periapical tissues, but rigid enough to get past that apical constriction and pierce any dentinal debris or tissue that may be at the apical 1/3. Now, one may think that if we are continually feeding a 08 hand file into the periradicular tissues, that the patient's going to experience more postoperative pain, when in fact they won't, because the science is very clear that when you establish and you maintain apical patency throughout the procedure, that you'll actually get less postoperative endodontic pain because you get less extrusion of debris past the apical constriction. So we'll carry on with the number 10 file, measured at 21 millimeters. We'll dip that in slick gel and work our way into. Every time we remove the file from the canal, make sure you wipe off the debris into the distal buccal and then into the palatal canal. They go quite easily. And when we're creating our glide path, we're also gaining information with respect to canal curvature, size, and calcification. It will allow us to determine which file sequence of the TF family we're going to use, either the small sequence or the medium-large sequence. And then the last file in sequence, in order to create that glide path, would be the number 15 file, measured at our working length of 21 millimeters. We dip that in a slick gel, place it in the mesiobuccal canal. Goes down pretty smoothly, but it's starting to feel a little bit snug. Into the distal buccal canal, which goes down pretty smoothly, but also a little bit snug. And then into the palatal canal, in which it glides very, very easily. Now we've established a glide path in all of our canals in the maxillary molar. During glide path preparation, we use our files in a clockwise, counterclockwise manner in order to feed it into the canal. In very tight and calcified canals, sometimes that can be quite tedious and quite fatiguing on our fingers. There is an instrument called the M4 handpiece. Now the M4 handpiece engages the handle of hand files, so it does the 30-degree clockwise, 30-degree counterclockwise reciprocating movement automatically. You don't have to think about it. All you have to worry about is the up and down motion in amplitudes of anywhere between 1 to 4 millimeters. Just to demonstrate the movement of the M4 handpiece with the file, I'm going to pre-curve the file, and we're going to slow down the motion. Right? And you can see how that M4 handpiece reciprocates 30-degree clockwise, 30-degree counterclockwise. Okay. The way we use the M4 handpiece is very simple. What we don't want to do is place the file in the M4 handpiece and then place it in the tooth, because we lose tactile control. The better way to do it is to place the file, pre-curve the file, and then with your fingers feed it into place until it meets resistance, or until it gets around to curvature. Then engage the top of the hand file with the M4 handpiece. We hit the foot pedal, it does the reciprocating movement, and all we have to do is the up and down motion. Direct it away from the furcation towards the safe area of the root canal. Let's slow this down a little bit so you actually see the reciprocating movement. The M4 handpiece is especially useful to facilitate the creation of a glide path not only around calcifying canals, but if you happen to have a ledge and you bypass that ledge, it's excellent for sanding away that ledge. As well, if you separate an instrument and are able to bypass the instrument, it's wonderful creating a glide path around that separated instrument.